So that would be great.
In terms of what, like, would you like me to tell you about like where I'm situated and sort of how would you like me to start?
You tell us about where you're situated and how exactly are the conditions over there.
Yeah, that sounds good.
We in Canada, there's a lockdown as
There
well.
is, yeah,
So
but not as extreme as
yeah.
India. So I am actually situated in Vancouver, so on the west coast of Canada, so right on the water there. And basically there's we have 10 different provinces and 3 territories. And because of the geographical location and where the population is dispersed, each of the provinces are all and territories are all reacting in different ways, because we have our federal government and then we have our provincial government. And so you'll see the causalities as well, where it differs from West Coast to East Coast because of a number of variables. The number of people that live sort of in the central part of Canada, where my family is, there aren't as many reported cases or deaths because of the fact that they're so central. It's still very snowy there. And they're still experiencing winter conditions, whereas here it's very beautiful. So the fact that it's geographically diverse has a big effect on the number of cases, but also one of the possible reasons why there is such a diverse number of cases is because of what we have a spring break where the children are out of school. So I have a 12-year-old, and they were out of school middle of March till the end of March, whereas the communities on the east of Canada had in March. So there's a high families traveling abroad and bringing back COVID, and that's where the spread has been more concentrated. Whereas on the West Coast, because of that, the cases have been lower. And then there were a number of speculations why our curve is a lot flatter than the rest of Canada. But overall, and I suspect similar to how other countries have been reacting to COVID, the governments on sort of the municipal level and the local levels have all sort of had a domino effect. So what one part of the country has been doing has led other parts of the country to either react slower or faster. For example, decisions that are made at the federal level have sort of trickled down to the local city level, where, for example, outside of our house, we have a park. So kids, a week and a half into the sort of recommended self-quarantine, the playgrounds were shut down. So then the city workers came to tape off the parks. And then over time, as you saw, the parks were closed down. So playgrounds and then parks. And then we just had, as I mentioned to you, Easter. So with Easter holidays, they were closing down beaches because here on the West Coast, it's actually very beautiful weather right now. So people are out and about. So they were closing down a number of accessible areas to then minimize access. And then in regards to other amenities and things that were considered essential services, for example, with grocery stores, we were taking a lot of learnings from other countries, like in Europe, where in the mornings there's a dedicated time slot for the elderly to go shopping. So I'm sure you're hearing and seeing a lot of these trends that were happening. And then so I'm happy to share with you, Deep, as well, just a high-level spreadsheet that I created with just different themes that our government was doing in terms of reaction to the community, but also the economic impacts, where there's a lot of financial impacts to individuals, to and as you probably are also well aware, the growing trend in general with the gig and freelance economy. So I find myself working in that space where I, in the fall, left a corporate job. So Canada's largest values-based financial cooperative, so at a bank, essentially. For 15 years, I worked there in the social impacts, do my own freelance work. So it's been interesting because I'm still very much connected into that space. So to see governmental regulations and policies affect businesses, and then looking across businesses, whether they are more, so if you look at the financial sector, like the big 5 banks in Canada, how they've reacted compared to cooperatives and social impact businesses, to then charities and nonprofits and the impacts around that, to the individuals and how we are being supported. So I can go deeper into that, but maybe I'll pause and see if you have any questions that have come up for you since I started talking.
No, we don't. We are not getting any questions right now because we are recording. So there'll be only 3 of us.
Okay.
So it will be rather great that if you can explain on that particular aspect,
Sure.
what you are telling us.
Yeah, no
You'll be very
worries.
much
So
than that.
maybe I'll start with how the government has been sharing the information, because for me, I think that's very important, because as I've been
Right.
watching across the world, there's a lot of scrutiny with how governments are connecting with citizens. So our prime minister has been doing, at least for the first 2-3 weeks, a daily update that sort of to address the nation. And so I don't know if you're aware, but his wife was tested positive.
It
So
was just for
yeah,
that.
so
Yeah.
him and his family were sort of under self-quarantine. He was addressing the nation from his home. And then of course there's sort of the trickle down effect where the chief public health officer would also address the nation, and then the federal cabinet minister. So sort of looking at it from the prime minister level, the health, and then the financial level, and how everyone's being impacted. And then later in the day, the provincial, so each of the own provincial leaders would then address their nations, and then similarly with the health and then the financial aspect of things. And then they were starting to roll things out fairly quickly. In my own opinion, I think that the prime minister has done a very good job in trying to be reactive and thinking
Great job.
through things and taking a lot of questions from the community and implementing it. So what we saw was things being announced sort of in the first week that they need to take action, have to provide financial support. Then first, it would pivot a bit to then provide more support, and then more support to small businesses, more support to nonprofits and charities. And then they were hearing startups and how maybe the way they were going to be qualified for support would then make them not qualified. So I think given the situation and the circumstances, the government is doing as best as they could compared to some of the other countries. So we've been fairly lucky in that front. And then also in terms of information sharing, I noticed that there were dedicated information lines. So there's a hotline that people could call. And if people, weren't able to access things on the computer, they call in. So they were trying to minimize that sort of in-person support. And then of course, things like social media was also very key in sharing the information. And then their actions was really tied into the World Health Organization and also the Center for Disease Control. So another tangible way of seeing their, I guess, decision-making and action was around, say, the masks, for example, where initially they were saying masks are fine. The N95s and anything that sort of medical grade was dedicated towards the medical professionals. However, as time went by, they were starting to then recommend, like in line with the CDC and the WHO, the homemade sort of bandana cloth. So we were seeing a spike of people who are handicraft artisans that are making masks and shipping them to people for donations for charities, for example. So it was really neat to see how community building has come together, because as you can tell from sort of my background and how you and I are connected deep around the social impact space, it was really great to see how things were pivoting. So actually on that note of pivoting, the government support and investment into infrastructure and various industries has been really great as well to encourage organizations and industries to pivot quickly. So for example, hand sanitizer, as you know, again, across the world, people and companies are starting to do that. But the government was offering financial support so that they could increase the different industries that are producing things. So for example, ventilators. So they've had a mass call out. So through the social impact space, they have convened what they called a super cluster. And the super cluster are comprised of individuals that work in this innovation space so that they have a network of people so they could then go out and offer financial support and also I guess knowledge support to try and help coach and guide different industries to work together and collaborate. So on a local level, we were seeing a lot of beer manufacturers and distilleries that were pivoting to then collaborate with other industries to get the right equipment and products. So I think that from a social impact and the community building perspective, that was also really interesting to see. And how people were coming together. And then the government, of course, as you've probably heard as well, in support with other countries, whether it was in the United States or in China, the sharing of either masks or testing kits and testing measures. And so pivoting in how that's being deployed out, getting it into the country and spreading it across the country. So a lot of the other municipalities as well were dealing with potential challenges with quantities. And so they were taking key learnings because on the East Coast, similar to New York, Toronto, Quebec, that's where the big spike is. So they were seeing that increase and spreading it across, which then allowed the West Coast to then utilize public or larger spaces like our convention center and mobilize that into a potential overflow for hospital and medical care so that they were able to increase by a couple thousands of potential beds for less critical patients should they need to tap into the overflow outside of the hospital facilities, which was really great to see in how quickly those are mobilized. And then also there are a number of different universities and medical facilities that were amping up their medical clinical trials and also testing of different potential, I guess, ventilators and different solutions to really amp up the lab capacity. So I'm, as I mentioned, from Saskatchewan. There's a number of medical labs out there and also what they call like the synchrotron and different facilities that they were able to pivot and be able to help test. So for example, when they were starting to cancel a lot of the sports, hockey, as you know, in Canada is really, really big. And so there was a running joke that the moment that they canceled hockey, Canadians were quick to jump to finding a solution. And they were starting to really test out the medical, different, I guess, strains of potential, I guess, sorry, my words are escaping me right now, but they were able to test out a bunch of different things to see if it would work. And so I'm not 100% sure where they're at with a lot of that, but in terms of the investment from the government, that was really key. And then I mentioned at a high level in terms of financial support from the government, they had announced a certain type of support. And then as they were starting to see an increase in unemployment insurance applications, which is managed by the federal government, they started to continue to accept them, but on April 6th announced what they called the Canadian Emergency Response Benefit Fund. And so targeting a lot of folks who don't necessarily qualify for unemployment insurance, but are either self-employed or were affected by COVID in some way, shape, or form, whether they had to care for an individual or were experiencing COVID symptoms themselves. And so that allowed people to qualify for about $500 a week, or about $2,000 a month. And they were very quick to roll that out. So how that worked was there was a portal that was opened on the 6th. They tried to encourage, to manage volume, people to apply. So if your birthday was January to March, it was Monday. And then on Tuesday, it was April to June, and so on and so forth. And I think people would just apply whenever, but they were able to roll out the funding and disperse it within days. So for example, I applied on the Monday and I received funding in my bank account by Wednesday or Thursday. So it was very, very fast. And I suspect that it was, they haven't really scrutinized. They're going sort of by the honor system, because my brother works in accounting, and he was saying that the government will look at your taxes and then they'll just sort of retroactive it, probably back, like sort of backdating it back to based on what your previous income levels were, which is really great for Canadians to be able to receive that fairly quickly. And then in terms of, as I mentioned, nonprofits and small businesses that were also heavily impacted, they then looked at wage subsidies. So in line with what Europe was doing, and also what some of the other communities were experiencing, the government has tried to be creative. So the Prime Minister had said that if you were a qualified business and you were to apply for wage subsidies or loans to keep your company afloat, to encourage companies to keep their employees employed versus laying them off, he was saying that there could be an amount of, let's say, $10,000 that then would be forgivable in the near future once we become operational again. So there are supports out there that isn't sort of, I guess, the financial burden that people have to hold, especially for small business owners. And then, as I mentioned to you, having worked at a values-based cooperative or credit union, it was very interesting to see, because I have 2 bank accounts. So seeing how this financial announcement came out from the federal level and how it impacts the individual, from an individual perspective, the credit. So for example, putting it on hold means that I don't have to think about paying at all for up to 6 months. That interest, and that interest that's being accrued, what my arrangement is with the credit union is that when it comes after 6 months, so October, it would then, it would just be tacked on whatever the interest payments were to the end of my mortgage loan. So then that would get rewritten into the overall payment. That is very, very different than what the banks were doing, and also what was initially announced. Because initially it was going to be, you had the option of paying just the interest. And then when 6 months came, you would pay the interest plus your regular payments, which then would be a bigger payment. And that's really stressful for people who may not be getting their regular level of income. So I think you're seeing a lot of solutions from the community base that's reactionary, that could be controlled from that level. And then also what's really interesting is that from a credit card perspective, the difference between the credit union and the bank, where the credit union has announced a 0 interest credit card. So if you were going to use your credit card to purchase food and whatnot, you can continue to do that. Whereas the banks have just lowered the interest rates, but they're still asking you to pay. So I was noticing this interesting trend between community-based organizations where they're able to create creative solutions from that loan perspective, from the products and services perspective. And then of course there's, small businesses and how they obtain their loans and whatnot too. So that was really interesting. And then the other piece that I found interesting, because my younger sister is in school. So as you know, having children, all the kids are out of school and they're very privileged to have access to devices and internet. Younger kids, the teachers were quick to respond as well. And again, this is managed at the municipal level. So we live in Vancouver, but a different school district would have different platforms, but they're overall trying to level set it at a provincial level and then at the federal level. But for example, right now, my son has homework that's assigned, and then we would work with them so that there's minimal disruption to the children. But when the announcement first came out, school was on minutely. A post-secondary level where people are in university and whatnot. My sister was in the process of being interviewed for medical school to be a doctor, and offer all of their interviews online. And so it was really interesting to sort of see happen too, where students were needing to go online to get things done fairly quickly. But then
Right.
from an employment perspective, right now is exam time for students in April. And then typically they roll into employment or internships post-secondary. So the government also has provided a student employment or some form of subsidy for that. So I don't believe the details have been fully rolled out yet, but the fact that they identified that they were a key group that was being affected and are working towards solutions for that was also very impressive, in my opinion. I think that they're definitely doing their best to address those things. And then I guess the other piece that's worthwhile noting was citizens who were abroad. So that was one piece where there are lots of Canadians who during the winter season leaves Canada because it's so cold here to go live in the United States, somewhere warm, or travel abroad. And so I found that fascinating as well because right on Monday, March 16th, the Prime Minister asked for Canadians to come home and for them to say, snowbirds, come home. It's spring break. If you've traveled, come home, and put in measures for repatriation. And I believe there was a certain allocation of funding, maybe upwards of $2,500, to help deal with the expensive airfares to get. Fascinating for someone like me, where again, I live on the West Coast, my family lives 18-hour drive to the central part of Canada, and I had considered going to spend time with my family. And in general, flights are very expensive in Canada, flying domestically. The
Right.
prices of airfare that week of March 15th-ish skyrocketed to about $1,000 Canadian dollars per person. So that would have been $2,000 for my son and I to fly, which is way too expensive. But I can't imagine people being repatriated, what that was going to be like. Again, my sister's in-laws, they live in Mexico for the winter, and it took them a while to get on a flight to come home. And by the time the second week of this self-quarantine rolled around, the government had then, instead of saying we recommend that you self-quarantine for 14 days, it became mandatory. And then by the third week or so, right when you get to the border, so they limited all of the border crossings to 3 or 4 different airports across Canada only. So all the other airports were not open to international travel. And then when they closed it down, they basically had folks who had to self-quarantine with a plan. And if you didn't have a plan, you were taken somewhere else until you came up with a plan. So that was kind of interesting. And then there was a lot of scrutiny between the Canadian and American border, because here on the West Coast, in Washington, as you know, Seattle is also one of the epicenters of the outbreaks. And as a result, a lot of Canadians on the West Coast were scrutinizing the Prime Minister's lack of action in terms of closing down the borders, because there are so many essential products that get shipped over the border in terms of the actual exchange. So eventually there was an agreement between the two leaders, which was really great to see. What else can I share with you? I guess the other interesting to note is the geographical disbursement. So a lot of Indigenous communities live in remote communities. And up north in some of the territories, there has been a lower number of reported cases of COVID. And so because these are also mentioned on a localized level, they are a lot more, and so they have all sort of marginalized and segregated, good, bad, otherwise. That's been see that some communities are less affected, but unfortunately due to the fact that they were marginalized and segregated as well too. Yeah, and then I guess the other piece is that the city isn't completely shut down, so we're free to leave, but it's just encouraged that we limit our outings. And a lot of restaurants are still open for business. So similar to what some of the other communities have done people are purchasing gift cards online to help provide that steady stream of income. And then there's the delivery services of food. And also, even I heard like today, they're delivering toilet paper. So whenever there's all these different microsites and also Facebook groups and social media where dedicated to COVID, when there's toilet paper available or when there's yeast available, like certain commodities, people would post on there, and then people would go out and purchase them or have them delivered and help out with the elderly communities. Yeah, so it's been good to see in that sense. And I think overall how people are feeling, people are, I think they're just tired of it all. I mean, I think people know that where we live in Canada, it's quite a privileged place, and that kids can still continue schooling. It's not as disrupted compared to other communities who don't have the means and the resources or even a safe roof to live under. And having said that, we do have a very marginalized community in what we call our downtown Eastside in Vancouver. So because it's such nice weather, a lot of Canadians who are homeless or experience drug addiction or various mental health issues end up coming together in the downtown Eastside because they can't sleep on the streets year round. For the most part, it's quite wet, but they washing stations and call out to community for hand sanitizer and educational opportunities to try and help address that community and the needs that they need, and also to shut down pertinent streets so that they can encourage self-distancing. So we do have those pockets where they are marginalized, but yeah, it is being addressed slowly. But I think overall people are being pretty respectful. We have seen an increase in petty crime. So because again, the drug addictions and all of that, we actually have a unique situation here where we have safe injection sites. So folks can, if they are dependent on certain drugs, can access it. But because of the challenges with the, I guess, the disbursement of the drugs, people who are addicts need it. And so they've been, like we, even in this building, has experienced an attempted break and enter. So you are seeing spike in crime, but not as much as what people would see. And then the other thing too is, as you can tell, I am of Chinese descent. And so it was also interesting earlier in March reading and hearing about some of the racial discrimination that's also been happening. So that it is, you know, a certain virus that was brought in from China and this and that. So there are certain aspects that has been affecting, I guess, citizen lives and whatnot. Yeah.
Right. Yeah. So it was a great overview, Jessica. Thank you. Actually, you gave me some of the questions that I need to ask. You have given a lot of information, which has covered so many questions that I was about to ask you. Of course, Justin Trudeau was one of the first prime ministers, one of the first leaders to come in and announce a big stimulus. So he has basically begun a big controversy within India as well, because we are yet to announce that much of stimulus package in India. We are still into lockdown phase, and most of the part in India has been completely locked down. None of the industries, restaurants, nothing are working, and it has been extended now, as I told you, for 3 weeks, and we are waiting for the stimuli. So now, whatever has been announced is supposedly debated very much to be very low, and we are expecting somewhere around 10 times of that particular amount of India.
Wow.
And I think Justin Trudeau has said it that the country has deep pocket. His speech has been very famous in India.
Oh, wow.
We have been seeing it. We have been seeing it on Facebook and YouTube-based channels. That he's been asking the countrymen to not to get afraid at all. So you spoke about some of the racial discrimination and some of the issues that has been going on in public discourse. So can you tell us more about that? How it has been discussed on public social media platforms, and how what percentage of people are engaged into it, and how much it has been taken toll on public discourse at large.
Oh, so before I answer your question, I see that our
Yeah. I think we have to, because we have got into our time limit, so we cannot record it further. So we'll have to take a minute of break, and then we can again
okay,
join,
rejoin again.
and then we can start. Yeah, we join
Okay,
again within
that
a
sounds
minute.
good. Why don't we do that then? And that way we don't get cut off.
Sure. Yeah.